Hi, my name's Heikki Uustal. I'm a physiatrist. I'm a specialist in rehabilitation, and more importantly, I subspecialize in amputee rehabilitation. I've spent much of my 25-year career working with patients and their families, following amputation, following them through the fitting of a prosthesis, the training with a prosthesis, and then even the lifetime issues that come along with amputation and living with amputation for a long time. I started my career at JFK in Edison, New Jersey. I spent most of my 25 years there, but the last 2 years I've been working also down here at the Shore Rehab Institute. Here we started a multi-specialty team where we work together with myself as the physician leader, a prosthetist orthotist, the patient, therapists, social workers, whatever is necessary to bring together and really help coordinate the care for our patients with amputation. The process starts with an evaluation. I spend much of my time physically evaluating the patient, talking to the patient about their psychosocial history, what their family support is like, what they did in their life, how they spend their day, both at work or at home, who is there to help them out when they go home. And then we move on to how we're going to help them get back to those activities following amputation. The fitting of a prosthesis oftentimes is a complicated process of taking a casting or molding of an individual's leg, then fabricating a prosthesis, a selection of parts including knees and feet, all of which are brought together to make a prosthesis that allows an individual to resume walking and doing most of the activities they did before their amputation. Now, along the way, lots of physical therapy is necessary, both in preparation for a prosthesis, training with the prosthesis, and all those little problems that occur later on in life. Oftentimes there's some moderate pain involved. That may be due to surgery, it may be due to the phantom feelings of the limb still being there, and it may be due to pressure from the prosthesis itself. All of those things that we try to handle as a team, both again myself as a physician, working with a prosthetist and therapist to help minimize any of that discomfort, to make your life comfortable and pain-free. And then it's restoring you back to all the things you did before. Driving, walking in the park, playing with your grandkids, swimming, going to the beach. All of those things are possibilities after amputation with proper training and with proper prosthetic fitting. We want to get to know you, we want to know who you are, what you did, and how we can get you back to that life after amputation. Any problem you're having, our team, our experienced team of physicians, of prosthetists, of therapists, should be able to handle any of those problems. As you know, Shore Rehab Institute can provide that care both on an inpatient or an outpatient setting. Many patients may start first in an inpatient setting where they're here at the hospital shortly after their amputation. They get a very intensive program of physical therapy, occupational therapy, psychological services, and physician care. As the wounds heal, as the pain lessens, as the patient is ready for prosthetic fitting, much of that occurs as an outpatient, and ongoing outpatient physical therapy will then occur. The coordination and the cooperation between the physicians and the physical therapists during that time is critical. We want to make sure that the best of care is provided and that any problems are taken care of as soon as possible.